My name is Julie Simpson. I'm a community cardiac nurse and I work for Liverpool Heart and Chest Hospital. I'm going to give you a talk today around cardiac medications. There are a lot of medications involved in this, so if you watch the first number of slides and then if you feel that some of the medications are not relevant to you, then please do skip a few slides. Slide 1. This is a chance for you to gain some information about the tablets that you are taking. Slide 2 is a content slide and shows you various topics covered. It also divides medications into certain disease categories, which you may find useful at the end of the presentation to go back to some appropriate slides. Slide 3. When you are given a new prescription, it's often useful to speak to either the doctor or the nurse about the medications that you have been given. It's always useful to know what medicines you are taking, why you are taking these medicines and the benefits these have for you, and any risks or side effects that might be involved. Sometimes there are specific ways to take medications to ensure that you are taking it safely, and it's often useful to know if you are able to buy any other medications, for example cold or flu remedies, and whether you will be able to take these with your medications. Slide 4. When will I need to take my medications? Most medications do need to be taken regularly, for example once or perhaps twice a day, or when you experience symptoms such as angina. It is therefore beneficial to follow any directions that you are given by your doctors, nurses or from the pharmacist. If you do miss taking a dose, then do take it as soon as you remember. However, if it is nearly time for your next dose, please skip the one that you have missed and take your next dose at the scheduled time. Do not double up taking any medicines for those that you may have missed. Slide 5. Will my medicines cause any side effects? Not everyone experiences side effects. You may have none at all. On the contrary, side effects are often temporary and they can disappear after a short period of time once your body has adjusted to taking those medications. If you do have ongoing side effects, then your doctor or nurse may be able to adjust the dose of that tablet or perhaps even change it to a different medication to help reduce any side effects that you may be experiencing. Whatever you do, do not stop taking your prescribed medications even if you start feeling that you are getting better. This can possibly make symptoms worse or even make your condition worse. There is a scheme called the Yellow Card Scheme, and what this does is it collects information from health professionals and medicine users regarding suspected side effects. If you do experience any suspected side effects which might be related to the medicines you are taking, then these cards can be filled out online. Slide 6. Some common questions. Why am I taking a blood pressure tablet? My blood pressure has always been good or low. Answer: because your medication often does control your blood pressure and therefore keeps your blood pressure low. If you do stop this medication, then your blood pressure may well rise again. Why have I got such a high dose statin? My cholesterol was below before I went into hospital. The answer there is you had a cardiac event despite your good cholesterol level, and research has proven that we do still need to lower your cholesterol, despite the fact it was a good level, by about 25% post any cardiac event. Slide 7. Can I lower my cholesterol without taking medication? Well, you can, but there is a limit to the amount of reduction you can achieve by diet alone. This is because it is simply the job of your liver to produce cholesterol, and your liver can produce cholesterol no matter how good your diet is. The medication also allows for a constant control of your cholesterol level, which can therefore only be achieved by taking your regular medications. And lastly, will I be on this medication for the rest of my life? Well, some of the tablets are lifelong, but we shall go through each medication individually and you can have a little look at the tablets that you are on and ascertain as to whether they are lifelong medications. On the whole, statins are lifelong medications, as are blood pressure medications. Slide 8. So, why do I take tablets? Cardiovascular medications can help the heart work more efficiently and can improve circulation. This helps control any symptoms that you may have. It can prevent any condition worsening, and it can also help avoid hospital admissions. Now, cardiovascular disease is a general term that describes diseases of your blood vessels, and the main types of cardiovascular disease are coronary heart disease. This is when the blood supply is reduced to the heart muscle. Angina. This presents symptoms of chest discomfort which are caused by coronary heart disease. Heart attack, which is when the supply of blood to the heart muscle is suddenly blocked altogether. There is a stroke or a transischemic attack, TIA, when the blood supply is interrupted to the brain. And then there is also peripheral vascular disease, where the blood supply is reduced to generally the legs, but it can include arms as well, and can also cause problems with erectile dysfunction in men. Slide 9. This covers medicines used in cardiovascular disease, covering the conditions mentioned in the previous slide, such as myocardial infarction, which is a heart attack, angina, stroke, transischemic attack, and peripheral vascular disease. These will all be covered in the following slides. Slide 10. These are the lifelong medications used in the diseases named on the previous slide. These are namely the antiplatelets, of which there is aspirin, ticagrelor and clopidogrel. There is combination therapy known as dual antiplatelet therapy, which is taking 2 of the above antiplatelet medicines, usually for 12 months, depending on your diagnosis and your procedure. There are also ACE inhibitors, the most common of which we use is called ramipril. There are beta blockers, the most common of which we used is called bisoprolol, and then there is your cholesterol lowering medication, the most common of which we use is atorvastatin. Slide 11, antiplatelets. Aspirin, ticagrelor and clopidogrel. Now, these medications help lower the risk of blood clots forming by reducing blood platelets stickiness, and therefore reduces the chances of these platelets from sticking together. It therefore helps prevent clotting in patients who have had a heart attack, who suffer with angina, or who have had ischemic strokes, TIAs, and any other forms of cardiovascular disease. They are usually prescribed preventatively when plaque build-up is evident, but there is not yet a large obstruction in the artery. Some common side effects associated with antiplatelet medications are heartburn, indigestion. To help reduce the chances of this, aspirin should be dissolved in water and taken with or after food. The GP may also prescribe an antacid, for example, lansoprazole, which is also there to help reduce incidence of indigestion or gastric irritation. These tablets can increase bruising, so while you are on dual antiplatelet therapy, you may notice you get more bruises. After 12 months, when your ticagrelor or your clopidogrel has been stopped, you may well find your bruising lessens. Ticagrelor also has a side effect of a catch-up breath or a gasp for a breath. Not breathless in the true sense of the word where you're puffing and panting. This side effect should resolve after 2 to 3 weeks. If there are any problems, do speak to one of your nurses or your doctor, and then this can be discussed. Do report immediately if you do start to pass any black stools, as this may be a sign of bleeding, which you do need to report to your GP as a matter of urgency. Slide 12, ACE inhibitors. Most commonly used is ramipril, but often perindopril too. Now, what this medication does, it expands your blood vessels, and by doing this, it decreases the resistance in your arteries, helping reduce your blood pressure. It therefore allows blood to flow more easily, and it makes the heart's work easier and more efficient. The main reason for this medication is it helps to treat and improve symptoms of cardiovascular conditions such as high blood pressure and also heart failure. With this medication, you are started off on a low dose in the hospital, and this dose should be gradually increased by your nurse or doctor. And following each increase in medication, you need a blood test doing 7 to 10 days later to check your kidney function, because we are aware that this medication can in fact affect your kidneys. Some of the most common side effects are dizziness. It can cause a tickly, dry cough, usually worse at night time, and it can cause taste changes too. If, however, at any point you ever feel you are developing any difficulty breathing with your face, your lips, your throat swelling up, then you must attend A&E immediately. It could be an allergic reaction to this medication. Slide 13. If anybody is intolerant to or has an allergic reaction to an ACE inhibitor, there is an alternative drug that we can use, and they are called angiotensin II inhibitors. The names of these common ones that we use are losartan, irbesartan and candesartan. Now, what the medication does. Again, this medication helps lower your blood pressure and reduce resistance for the heart. Now, the reason for this medication, again, is to treat or improve symptoms of cardiovascular conditions, including high blood pressure and heart failure. Similarly to the ACE, you will need a blood test 7 to 10 days afterwards to ensure it is not causing any problems with your kidney function. And common side effects include dizziness and gastric upset, such as diarrhea. Slide 14, beta blockers. The most common ones we use are bisoprolol, but we can also use atenolol, carvedilol, sotalol and metoprolol. What this medication does, it decreases the heart rate, which can also lower the blood pressure. Therefore, your heart beats more slowly and with less force. So the reasons for this medication, it can be used to help lower the blood pressure. It can be used in conjunction with other therapies for cardiac arrhythmias, and it can be used in treating angina, and also to help reduce the risk of future heart attacks. It is also used in patients who have a diagnosis of heart failure. Side effects to this medication include tiredness, cold hands and cold feet, sleep disturbances, and it can cause or make worse impotence. Beta blockers can also have an adverse effect on diabetes, as it may mask certain hypoglycemic symptoms such as palpitations. Slide 15. If you have an allergy to beta blockers or cannot tolerate the beta blocker medication, there is an alternative that we can use called calcium channel blockers. There are two different types of calcium channel blockers. There are the rate reducing, namely verapamil and diltiazem, and these work by slowing the heartbeat down, which is very similar to the beta blocker. There are also non-rate reducing calcium channel blockers, namely nifedipine, amlodipine and felodipine, and these work by widening blood vessels. Now, the reasons for this medication are very similar in that they are there to treat angina, help reduce blood pressure and help regulate your heart rhythm. Side effects include facial flushing, headaches, ankle swelling and constipation. Slide 16, nitrates. This is a medication that is used to treat and to prevent angina symptoms. It comes in a variety of forms. First of all, it comes in a spray or what we call sublingual tablets. By that, it means the tablet goes under your tongue and it dissolves fast. These can be bought from a pharmacy in case of an emergency. GTN is used to relieve angina, but it can also be used to prevent angina. If you do get angina, we advise you sit down and relax and use 2 puffs of your GTN spray under your tongue, or pop 1 little GTN tablet under your tongue. Little bit of clock watching now. Give it 5 minutes to go. If it has not relieved, use your GTN for a second time and wait a further 5 minutes. If at this point it still has not relieved, then do dial 999. If you find you are needing to use your GTN spray more regularly due to worsening angina, then it's advised that you contact and make an appointment to see your GP. Now, there are long-acting nitrate medications, namely isosorbide mononitrate, Imjor, Monomax and Monomil are the most common names. They do give longer relief as you take them in the morning and they work throughout the course of the day. You can, however, use your GTN for what we would call breakthrough pain. Now, the side effects of nitrates include headache, facial flushing, dizziness and a fast heartbeat. Slide 17, some important information about your GTN and what we call our GTN protocol. So, if you were to get angina, you need to stop what you are doing and sit down. Tell someone how you are feeling, and at this point you may then take 1 to 2 puffs of your GTN spray or 1 tablet under your tongue. You wait for 5 minutes. You may feel a little bit of dizziness, a headache or some facial flushing. If your symptoms go away, then you can resume your normal activities. After 5 minutes, however, if your symptoms have not relieved, you may take another 1 to 2 puffs of your spray or spit out the remainder of your little GTN tablet and pop another one under your tongue. Again, wait 5 minutes. If your symptoms are relieved, you can resume normal activities. However, if they have not, then at this point you need to dial 999 and treat it as a suspected heart attack. Slide 18, statins. The most common statin we tend to use is atorvastatin, but other ones available are simvastatin, rosuvastatin and the less used pravastatin. What does this medication do? Well, statins help lower the level of cholesterol in your blood. It also reduces what is often referred to as a bad cholesterol in your blood. This is called the low density lipoprotein, otherwise known as LDL. They work by reducing the production of cholesterol inside your liver. The reasons for this medication: by lowering your cholesterol, it has been proven that we can reduce the risk of all cardiovascular disease, which includes heart attacks, strokes, and peripheral vascular disease. Some common side effects from the statins are upset stomach, diarrhea, headache, feeling sick, or insomnia. Whilst taking this medication, you need to avoid eating grapefruit juice. The enzymes of the grapefruit react with the medications, making your medicine more potent. An uncommon side effect is muscle damage. It tends to affect all the larger muscles of your body. If you do experience muscle pains, weakness and cramps, do report these to your GP or your nurse. There is a specific blood test that we can do to determine if these side effects are related to your medication. When you first start off on a statin, you do need your blood test doing after 3 months. This gives the medication a time to get into your system and slow the production of cholesterol. So after 3 months, we would check your liver and your cholesterol function. We check the liver because it is the liver that produces the cholesterol, and we check your full cholesterol screen as well. Once we know that your cholesterol level is stable, then blood tests are required every 6 to 12 months, depending on your GP. Slide 19. There are also other cholesterol medications, such as ezetimibe. This works differently to a statin. It reduces the amount of cholesterol that gets reabsorbed back into the body as all the waste food goes through your intestines. This can be given with a statin or it can be given alone. There are also the fibrates, which are very effective in lowering the triglyceride arm of your cholesterol screen. This helps reduce liver production of the triglyceride. It speeds up removal of triglycerides from your blood. However, it does not lower your LDL. An added benefit to the fibrate is it can also increase what we call your HDL, which is a high density lipoprotein, which is a good cholesterol. And like ezetimibe, a fibrate can also be prescribed with a statin. Side effects include nausea, stomach upset, diarrhea, and this too can irritate your liver. So again, after 3 months, we do check your liver function with your lipid profile. We now move on to medicines used after cardiac surgery. At this point, check your medication list. We may already have covered all the medications that you are prescribed and take. If this is the case, then please skip to slide 28. We are yet to cover medications used after cardiac surgery, medications used for cardiac arrhythmias, and medications used in heart failure. First of all, slide number 20, we will cover medicines used after cardiac surgery. Slide 21, medications post-cardiac surgery. Most common medications used here are analgesics for pain relief. You may well be prescribed paracetamol, which you can use 2 tablets 4 times a day, wise to spread them out over the course of your waking hours. And also dihydrocodeine, a strong codeine-based medication that can cause quite intense constipation, so please be aware of that. Over the first few weeks post-surgery, you may wish to reduce the dihydrocodeine every couple of days as you start to improve. And over the following weeks, you may also wish to start reducing the paracetamol, again as your post-op recovery improves. Do be aware that as you start to become more active following your surgery, you may find that you feel the pain has increased, but this will do so as you are reducing your painkillers as well as increasing your activities. Given alongside these analgesics are laxatives, senna, a small tablet that you take at night time, which can help the bowel function, and lactulose, which helps keep fluid coming into your bowel to soften the stools to keep it easy to pass. These are really quite important, especially when taking dihydrocodeine. It is recommended that you do take them daily to keep your bowel habits normal. As you reduce and stop dihydrocodeine, you may be able to reduce or stop your laxatives. This just requires a common sense approach, watching your bowel habits. Some people are given diuretics, which are water tablets, namely furosemide. This is covered in a little bit more detail on slide 26. Others, if needed, may be given antiarrhythmia medications such as amiodarone, digoxin, NOACs, warfarin and bisoprolol. These will now be covered over the next few slides. Slide 22, medications used for cardiac arrhythmias. It might often be heard as AF, which stands for atrial fibrillation. Moving on to slide 23. Some antiarrhythmic medications are used for rate control and some are used for rhythm control. Rate control is where we try to slow your heart rate down, and rhythm control is where we try to control the rhythm of your heart. Amiodarone is the first drug of choice for a post-op cardiac arrhythmia. It is usually initiated in the hospital by a specialist and therefore must only ever be stopped by a specialist. It helps to improve the heart rhythm, acting like a pacemaker to try and help regulate the heartbeat. It may be used short term if it is post-operative AF, as this can settle with time. If on this medication long term, you will need regular blood monitoring, perhaps every 6 months, to check your thyroid level and your liver function. And you must remain out of sunlight using full sunscreen or sunblock and long sleeves and a sun hat, as one of the side effects is tinting the colour of your skin, and this is a non-reversible side effect. Another antiarrhythmic drug used to treat AF is digoxin. Again, this is for rhythm control of your heart. And finally, bisoprolol, which has been covered on slide 14, which helps to improve your heart rate by slowing down your heart. Slide 24. There is additional treatment used for cardiac arrhythmias that thin your blood. AF, the most common arrhythmia that we treat, does carry a risk of causing a stroke. To help reduce this risk, we need to thin your blood, and there are a variety of medications available. Firstly is warfarin. Warfarin literally does thin the blood, helping reduce the risk of a stroke. Whilst on warfarin, you do require regular blood tests, perhaps weekly initially, and as this settles down with time, you may end up perhaps once every 2 weeks, once every month. It just depends how stable your blood tests are. Whilst taking warfarin, there are restrictions on alcohol and certain foods. These will be clearly listed in a little yellow book that you are given to carry with you at all times. It is an information booklet and record card that you need to carry with you at all times. It will have your most recent blood results in it and information on do's and don'ts and safety. A most recent form of medications prescribed for rhythm treatment are a group of drugs called NOAC. These are dabigatran, apixaban and rivaroxaban. Again, they are there to thin the blood and to reduce the risk of clots from forming, which may well otherwise cause a stroke. Unlike warfarin, NOACs do not need regular blood tests to check your levels, which is a bonus. When you are taking anticoagulants, you are at increased risk of bleed. If you were to cut yourself shaving or to cut your finger, you will need to apply more pressure and for longer. You may find if you ever suffered with nosebleeds, you might get a nosebleed more often. If you are a lady menstruating, then obviously your periods will become heavier. So these are all things that you really must look out for. And if there are any issues, then these need to be discussed with your doctor or your cardiologist. Slide 25, medications used in heart failure. If you have not been given a diagnosis of heart failure, and we have covered all of your medications so far, then please skip to slide 28. For those of you with a diagnosis of heart failure, or if we have not yet covered all your medications, go to slide 26, which is the next slide. Slide 26. Two of the most common drugs used to treat heart failure are ACE inhibitors, which you can revisit by going back to slide number 12 or onto slide 13 for the alternative of the ACE inhibitors, such as losartan. You may well be on a beta blocker, which you can revisit by going to slide 14. You may also be on an antiarrhythmic medication, such as amiodarone, digoxin, warfarin, or dapigatran, apixaban, or ivaroxaban, which you can revisit again going to slides 23 and slides 24. Here we will now cover diuretics. The most common diuretics used are furosemide, Frumil, and bumetanide. Other ones used are bendroflumethiazide and metolazone. What this medication does. This medication helps your body get rid of unnecessary water and salt via the kidneys in the urine. By doing this, it does make it easier for your heart to pump. It also helps control your blood pressure, and with reducing the amount of fluid in your system, it can help relieve symptoms of heart failure, such as decreasing the swelling, which is called edema, that can occur in legs, or edema which can also occur in the lungs. The purpose of this medication is therefore to treat high blood pressure and to treat your heart failure, and are used as much as a preventative to help reduce the chances of congestion, as well as treating symptoms of heart failure. Side effects can include an upset stomach, dizziness, a dry mouth, blurred vision, headache, and feeling tired. If these symptoms are very troublesome, then obviously it will be an idea to see your GP. They can also reduce the function of your kidneys, so blood tests are necessary with any changes in the dose of these medications, or in fact if you are started on a new diuretic. This blood test needs doing 7 to 10 days after the dose change, and then every 3 to 6 months once you are stable. Slide 27. There are additional diuretics which are more specialised for heart failure, and these are called spironolactone and allopurinol. They are used in heart failure and for anyone with resistant hypertension following a heart attack. It does have a diuretic effect, similar to the other water tablets. And side effects include an upset stomach, tender and enlarged breasts, including gentlemen, at which point the medication does need to be stopped, but under the advice of your specialist. And again, it can reduce the function of the kidneys, so you will need regular blood tests done to monitor the function of your kidneys. Slide 28, ongoing care after discharge from the cardiovascular rehabilitation service. You will need to see your GP for ongoing care regarding blood tests, blood pressure and pulse checks. We suggest you arrange an appointment with your practice nurse 1 month following your discharge to get a blood pressure check and a general review. Following on from this, it is your responsibility to ensure that you do have at least biannual checks, in other words, twice a year. This can be done with your practice nurse or your GP, and this will need to be discussed within the practice, as all our GPs do work slightly differently. It is always worthwhile asking your practice nurse or GP how often they wish you to be reviewed, because some medications will require more frequent visits and checkups. Now, the general blood tests often include liver function, kidney function, a cholesterol screen, thyroid function, glucose or a diabetic HbA1c check, and also a haemoglobin level. These may not all be applicable to you, but a number of them will be, so please do discuss this with your GP and practice nurse. Remember, it is your responsibility, not just your doctor's, to look after your health, so please do mark on your calendar when you are next to a review, and don't hesitate to phone up and arrange that appointment yourself. Slide 30, some important points about your medications. It is worthwhile carrying a list of your medicines with you. This can be handwritten or a copy that is printed off from your doctor's practice, but please remember to update this list if there are any changes in either the tablets or the dose of those tablets. It is also worthwhile getting to know the names of your medicines and what they do. You are never advised to stop taking your tablets unless you have sought medical advice. Side effects can often mean we can reduce medications or change them for an alternative tablet. And this is something that you will need to sort out with your doctor or your practitioner. A number of tablets need to be weaned off rather than just stopped, or they can cause problems with your health. It is always worthwhile asking the pharmacist before you buy any over-the-counter or herbal medicines. So for this, it is recommended that you use the same pharmacist each month to get your medications, because your electronic list will be on the computer that they can check and make sure that you are fine with any of these medicines you wish to purchase. Now remember, many people don't get any side effects from any of their tablets, yet others do. So don't suffer in silence. If in doubt, ask your cardiac nurse, your doctor, or your pharmacist. 31. Here is a list of the medications that have been covered in today's talk. So if you have missed any of these medicines out, then please feel free to ping back and go to the appropriate slide so you can learn again about all of your medications. Okay, I hope you have all the information you need. Don't forget there are leaflets with every medication pack that you can use for further information. If you do feel you need to speak to one of the nurses or the pharmacist, then obviously please do so. All right, thank you.